So I wanted to talk about PRP, which is platelet-rich plasma. There's a lot of uses and benefits for this, and on our website we have a pictogram that really shows from head to toe all the ways and manners by which we use this. And if you do research or search it, it's interesting that it comes up in orthopedic websites, in dermatologic websites, in plastic surgery websites, and OBGYN websites. So we know that this is something that's useful across many disciplines and specialties, and we find that to be the case as well. One of the more common places that we use this is with facial rejuvenation and facial aging procedures. So with very deep wrinkles, with dark circles under the eyes, with the nasolabial folds, we inject small aliquots of PRP. And I should step back and say that the way PRP is harvested and how we generate this is it comes from your own blood. So when we're doing these procedures, or if you're coming in for PRP treatment alone, we draw a little bit of blood, about 10 cc's. That is then centrifuged, and we are able to generate about 5 to 7 cc's of PRP from this. It's then transferred to small syringes, and with small needles, it can be microneedled into the skin, meaning very small aliquots of it are placed all around the skin in a general way, which can recondition the skin, improve the texture, improve the appearance of the skin, tighten the skin, bring new blood supply to the dermis, help with red areas and other pigmented areas and that type of thing. With facial aging, we use it in the lower lids, so dark circles under the lower lids. It can help bring better blood supply. We can use it to help in areas of folds like the nasolabial folds and marionettes. We can use it in the lips, and when we mix it with fat as well, or inject the same area with both PRP and fat, I should say, the PRP helps a lot of the fat stay viable. So whenever you do fat grafting, some of it's going to resorb. PRP, because of the blood supply, helps more of that fat stay for a longer period of time. Other areas that we use this include the TMJ. We do a lot of TMJ surgery here related to orthognathic jaw surgery and asymmetry, particularly sometimes related to clicking and popping and some TMJ arthritis. PRP is used in the orthopedic literature for arthritis, and when we're reconstructing or doing manipulations within the joints, if we're shaving the top of the condylar head, PRP is excellent in that inferior joint space. When we're repositioning the disc of the TMJ, there can at times be holes or perforations within this, and PRP can help regenerate that, especially if we're reconstructing this with fascia or amniotic membrane. We place PRP there as a barrier as well, and we can inject it into the superior and inferior joint space of the TMJ. So it's very beneficial in joint pathology and joint arthritis and reconstruction that we are doing the TMJ. We also use it in bone grafting. When we do a cleft lip and palate alveolar bone graft, we take bone from the hip, and by mixing that with PRP, it makes the bone in a more handleable way. So instead of the bone pieces not being really held together, the PRP congeals and has that bone so that it's held in a nice platform, putty almost together, and the growth factors within there help that bone remain viable and heal and fuse one site to the other. So it's excellent for bone grafting. We do bone grafting as well prior to dental implants, and mixing that bone with PRP really increases the yield and the stability of that bone. The other area we use PRP is for genital rejuvenation, something called P-shot or V-shot, which can improve the blood supply and the nerve growth and ingrowth in some of these areas. And lastly, with aging as well, at times the hands can have a certain appearance to them, and the skin can look a little more aged and irregular on the hand, so we tend to use a lot of PRP, sometimes fat grafting on the tops of the hands, as well as laser to make the hands look really young and restored as well. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com.
Thanks again.